Physicians in Massachusetts have been strong supporters of our state health reform right from the beginning. Universal coverage has been better for our patients, and it's better for the practice of medicine. When people have insurance, they are more likely to get care when they need it, and they are more likely to take care of themselves. They are also more likely to discuss preventative health care measures with their doctors and follow them, and that leads to longer and more productive lives. And when citizens are in good health, society is also more productive. The economy is vibrant, and the social fabric of our community is as strong as it can be. That's why we are so pleased the ACA was upheld. Universal coverage is a state-federal partnership. No state can do it on its own. We've accomplished quite a bit since 2006, and there's still a lot of work to do. Affordability is still a big challenge. We promise to work with the governor, legislators, and the leaders of the healthcare community to ensure the noble vision of our healthcare reform law is fulfilled for many years to come. Thank you.
Here we are, advocates, consumers, labor leaders, religious leaders, providers, employers, insurers, and government officials, and we are united in our commitment to continue to work to bring affordable, high-quality coverage to every person in Massachusetts.
We have a lot to celebrate, and we're really happy that we've been doing a lot of hard work to be ready for ACA in 2014. So 2014, here we come.
More than anything else, I think today we should be proud to be Americans. Proud to live in a country with a democratic form of government with checks and balances that has served its citizens so well over history and has served all of us so well today.
For us here in Massachusetts, this also means that we can continue to innovate in the ways that we deliver access to integrated models of care delivery for some of our most complex and vulnerable members.
And I'm very proud to live in Massachusetts. In Massachusetts, health reform has not been a political football. It's been about getting families the care they need and the security they deserve.
Thanks to Massachusetts healthcare, I am finally climbing my way back to good health, and I feel like I have a chance at life again. A country is not healthy if its people are not healthy. A healthy and productive population is a critical part of America's strength. A country cannot thrive if its citizens feel abandoned in times of ill health and hardship.
Because right now, 30 million Americans are exactly where my people were 8 years ago, needing health insurance. To these millions of people, we shout from this hill in Boston, there is a balm in Gilead. There is a balm in Massachusetts. And now there is a balm in Wisconsin, in Mississippi, and in Idaho. And to that, the people of our faiths in Greater Boston Interfaith Organization say, Amen.
One thing you should notice here, this is a lot of strange bedfellows, or it felt like it 7 or 8 years ago, but we've actually all become friends with a sense of shared responsibility. And I want you to know that today, Massachusetts healthcare workers are celebrating because we know firsthand as healthcare workers that mass reform has saved lives, and that moving forward, national reform will do the same thing.
There's no question about it that this coalition, standing shoulder to shoulder with our Governor DePaul Patrick, Secretaries Dr. Bigby and Jay Gonzalez, have made the mountain move, and we have to continue to move it not only here but nationally.
Hospitals have supported the Affordable Care Act from the beginning, and we continue to do so for a very simple reason. It's the right thing to do. It's the right thing to do for our country. It's the right thing to do for our state. It's the right thing to do for those with insurance and for those without insurance.
This is also a victory for women's health, a victory for women across our nation who will now benefit from many of the same reforms that Massachusetts women have enjoyed, including a ban on gender rating and excluding women due to pre-existing conditions.
You know, probably everyone in this room, like I could do, can reach into their pocket and pull out a card. Mine, of course, has a Blue Cross on it. And that card tells people that they're going to have coverage. And whether that card says Harvard Pilgrim or Tufts or Mass Health or Network Health or any of the other great plans in Massachusetts, it means security.
It means that when you're ill, someone's going to be there to help you and you're going to be protected financially.
I was proud to be part of this broad-based coalition, which is really unique, and I think Celia mentioned it. Many of us don't often see eye to eye on issues, but we were all committed to the implementation of the universal health care law here in Massachusetts back in 2006 and have hung together for the past 6 years to make it work. And I'm proud to say to be part of the next wave of reform, which Andrew just talked about, which is making sure that it's affordable both for employees and their employers.
Because I moved to Massachusetts when I did, I got health care right in the nick of time. If I hadn't, I might not have been able to get the insurance that covered me through chemotherapy, radiation, and about 5 surgeries. I really feel like the Massachusetts healthcare system swooped in at the right time and saved my life, and I am so grateful that the Supreme Court has affirmed this care for my friends and the rest of the nation. Thanks.